Doctors of Reddit. What's your weirdest case of a patient accurately self-diagnosing? Story 1. Remember that dude who peed on a pregnancy test kit as a joke and got a positive, and Reddit told him it might have been testicular cancer, and how he visited a doctor and it turned out to be testicular cancer. Story 2. My dad, who is a great person but also occasionally and took my 3-year-old sister to the ER with the flu. Thing is, there was a meningitis outbreak in the area, and the ER was packed at being and tells the nurse he is suspecting meningitis to bump us to the top of the list. The doctor is pissed because she has no meningitis symptoms, no stiff neck, no fever. They get into an argument. He orders a spinal tap. Since Dad is concerned, Dad will not back down at this point, and it comes back positive for meningitis. Story 3. I had a patient who predicted her own death. She was a relatively healthy 90-year-old with hypertension and diabetes. She woke up that morning, told her daughter that she was going to die. She made her daughter go to a lawyer's office and sign a living will, confirming DNR-DNI. That evening, she had a massive heart attack and was rushed to the ER. We tried medical management, but per her wishes he living will that she signed like 6 hours earlier, she did not want any invasive measures taken. She died about an hour after she came in. Story 4. During my second lung collapse, the doctor was adamant that it was just a panic attack. Since it felt exactly like my first lung collapse, I kept insisting he take an x-ray. After the x-ray results, he said against all probable odds you were right, and I had a tube in my chest within the hour. Story 5. So, some backstory. Not a doctor, but really who is in this thread. In 6th grade, my best friend had his appendix burst in the middle of the night. After hearing about it, I was utterly terrified of it happening to me. My parents and doctors all told me it is relatively rare, and if it did happen, there isn't really anything to worry about. I asked what it felt like if it did happen, and they said, "Oh, you'll know, yeah, thanks, really helpful." But my appendix bursting became somewhat of a phobia of mine for over a decade. Every time I felt abdominal pain or severe gas, I always jumped to the conclusion of appendicitis. So about 10 years later, I'm hanging out with my friends when I started to feel some bad gas pressure coming on. Nothing too bad, but nothing would really make it go away. After I got home, it was still rather bad, but I figured I'd just sleep it off. Woke up at about 5 a.m., curled into a ball, throwing up on my pillow. At this point, I was still living at home with my parents, so I hobbled my way to their room and woke them, telling them I think my appendix was going. They told me it's probably gas. And are you really sure we should take you to the ER? I told them I was sure it was my appendix, and they sort of told me to wait it out until 7 when they could phone the family doctor. So I curled into a ball in the bathroom and threw up for a few hours. At 7 on the nose, they called the doctor, and I described my symptoms, and the doc told my parents to take me to the ER now. So we get to the hospital, and I'm walking so hunched over my face is almost at my knees, bring me into the ER, and they order a CT scan, think it was a CT, was kind of out of it, and put me on some killer anti-nausea pain meds. The endoscopic surgeon comes in with my CT scan and tells me, verbatim, this is the most clear-cut case of appendicitis I have ever seen, and asked me to sign a release because he was going to film the operation endoscopic bits at LEAP for training materials. So long story short, I had appendicitis. I knew it, and it was so clearly appendicitis that the doctor wanted to film it to teach other surgeons. So for any aspiring endoscopic surgeons in the thread, maybe you get to see inside me. Story 6. Not a doctor, but the Texas shooter diagnosed himself with a brain tumor, and no one believed him, despite him going to multiple doctors and begging to be checked. He literally killed a bunch of people to prove to the doctors there was something wrong with him, and gosh darn it, if the autopsy didn't find a giant tumor in his brain pressing on the aggression center. Edit: the shooter's name is Charles Whitman. I now realize how ambiguous the title Texas shooter sounds. Story 7. Not a doctor. I had gallbladder problems some years back and went to the doctor. He said my blood work came back normal and that it was probably either indigestion or a strain muscle. I told him I knew it wasn't. He asked me what I thought it was, so I told him I was certain it was my gallbladder and that it was full of stones. He told me verbatim, "You're not middle-aged nor overweight, so it can't be that at all." I told him rather sternly to order the ultrasound because I was very certain he was wrong about what he thought it was. Half hour later, I'm laying there getting the ultrasound done when the tech was all, "Yeah, so I'm not supposed to tell you anything, but I'm going to anyways. That is a fat sack of stones. I've never seen a gallbladder this bad before. My gallbladder was full of large and small stones." I cried and thanked him, then cried more because I was so angry with the doctor and the nurse practitioner and the previous nurse practitioner I saw a few months before that appointment for the same pain, who wrote it off as a strained muscle in my back. After the doctor saw the ultrasound, he came in with a nurse practitioner and 3 other nursing students to tell me I was right and to give them a lesson on listening to patients and to not just brush off their concerns and suggestions. Almost 2 weeks later, I was in for surgery. Good grief, this turned out longer than I expected. Story 8, went to the same emergency room, twice explaining that something was up in my head. They diagnosed me with anxiety attacks both times, had stroke 2 days later. Story 9, not a DR, but a chronic patient. I have a rare neurological disease that causes tumors to grow in the nervous systems and on any other type of body tissue, but the nervous system tumors are most common. I was diagnosed at age 4. I've been treated by the same clinic for over 25 years, having seen the same specialist for 20 of those years. The hospital where I'm treated is more than 3 hours away, but my local hospital is affiliated with them. I woke one morning with severe hip pain, swelling in my thigh, and a terrible limp. I went to my small town ER, where I was told I had a skin infection. DAR just visually examined me, ran no tests, and told me it was razor burn from shaving my bikini area, was giving an antibiotic. My disease is in my medical records, which the hospital had access to since it's the same medical facility, just different locations. 2 days later, the entire inside of my thigh had turned purple and blue. I couldn't walk without excruciating pain. I went to an express care like a step down from the ER. They immediately sent me to the ER for symptoms of a blood clot. The on-call doctor notified the ER I was coming, demanding an ultrasound. I arrived back at the ER, where the DR basically told me she wasn't ordering an ultrasound because it wouldn't find anything, was told the bruising was self-induced to get pain pills, and that I was being discharged and blacklisted. My husband flipped and demanded an ultrasound, threatening legal action if not. Dumb doctor gave me attitude, but eventually ordered the scan. The ultrasound tech turned white as a ghost, quickly turned off the monitor, and rushed to get the DR. Turns out I had a tumor the size of a 12-ounce soda, growing off a major nerve in my groin. I somehow strained the muscles around it, damaging my nerve and muscle. Never got an apology or admission of being wrong from the doctor. My specialist later told me she had a lot of fun talking with the DR with heavy sarcasm. Story 10, had a patent at the ICU on a ventilator because of rapid lung fibrosis. Usually it's triggered by medication or an outside trigger, pets, feces of pets, etc. We stopped one of his cardiac medications, which is known for being able to cause this kind of syndrome, and the progression of his disease stopped. We told his wife, and she said, yeah, I knew it was this particular drug. The dog told me. We were shocked and asked her to explain. She told she had been feeding the different drugs of her husband to the dog over a period of 2 weeks, every day a different drug, and he had started barking when she fed him this particular drug. Story 11, not about a doctor, but an EMT. When my friend was in college, his appendix burst. He was in extreme pain, couldn't really move, and was acting delirious. His girlfriend called 911 and said she thinks his appendix burst. Ambulance shows up. EMTs think he's just drunk and refuse to take him seriously. They take their time, give lots of attitude, lecture them about drinking underage, all while she is panicking, telling them that he doesn't drink and needs to be at the hospital now. She was right, and the EMTs almost killed him. Story 12, sorry I'm not a doctor, but last year when my daughter was 3 months old, she stopped eating and pooping. Then she started getting weak and limp, and it got to a point where she couldn't even close her mouth and eyes. ER doc said she was dehydrated and put her on N4 overnight. The next morning, she was worse. How are you worse, but not dead yet? Ick. Anyway, I read an NYT article that was meant to be a riddle for medical professionals, and the riddle described my baby to a T. Most of the commenters guessed infant botulism, so I suggested it to the pediatrician that came the next day. He said no, she's probably still dehydrated. That immediately made no sense, and she'll be fine, we can go home. Mind you, we live in NJ, and this was in NC. We were on the way back home for a road trip to FL. I wasn't having it. We asked to transfer to a children's hospital. The docs there did every test they could think of, and nothing was coming up. I begged them to test for IB and gave them full permission to laugh at my lack of medical expertise. And since they already tried everything else, they obliged. It was IB, the first case that hospital had seen in 20 years, I think. The residents on her case wrote a paper about her. Story 13, for 16 years, I complained about severe pain, loss of blood, listlessness, and extensively long periods. We're talking 13 to 17 days. I kept getting told that it's normal, I'm exaggerating, it can't be that bad, I must have a low pain tolerance, etc. I tried every single form of birth control over those 16 years. In 2008, I had exploratory surgery since my GYN couldn't figure out what was wrong. Turns out that I had severe ovarian torsion, which they repaired, and they also found quite a bit of endometriosis and removed it. I still had heavy long periods, but the pain wasn't as bad. Then the pain started coming back in 2015. After several ER trips, I finally get an appointment with a new GYN. I said I was tired of this and wanted a hysterectomy. She said before doing something so drastic, she suggested trying an IUD. So I did an IUD for a year and got such bad depression from it I wanted to kill myself. on top of horrid pain anytime I had, and with months of constant bleeding. Then this past June, my GYN agreed to do a hysterectomy. I was full of endometriosis, adhesions, and cysts. I was having bladder incontinence problems because my bladder was completely surrounded by the endometriosis. Now, I am 3 months post-op, and so glad to be free from all the pain and bleeding, plus the bonus of never having to worry about an unwanted pregnancy. Story 14, not a DR, but I started having painful abdominal spasms, and I was sure it was my appendix. I have a very high pain tolerance, so for 2 days I was still carrying my heavy toddler and working out. I told my husband and family, and they wouldn't believe me and told me it was just gas, but I knew something was wrong. Anyways, I decided to go to the hospital despite my husband's protests. I was making a big deal. The DR didn't believe me. They sent me for a vaginal ultrasound because she thought it was probably an ovarian cyst. I was pissed they weren't believing me, so I let them give me the ultrasound anyways, came back negative, and they were about to send me home. Decided to make my husband drive me to another hospital. Everyone was pissed. I was making them waste their time since my husband had to miss work, and my mom had to watch her son. Anyways, turns out I had appendicitis, and my appendix was about to burst. Doctor said if I would have waited a few more hours, it would have burst. Had surgery within an hour of showing up. I was pissed at everyone that didn't believe me. Ha. Story 15, not a doctor, but a patient. I woke up one morning with a severe pain in my side, and I instantly knew I had a kidney stone ID past one before. I'm a female BTW. Couldn't get into my regular doctor, so I made an appointment with the first guy who was available to hopefully get pain meds to make passing it a little more bearable. I go in to see him, and he is hands down the most arrogant and condescending doctor I've ever seen. When I try to explain to him that I know it's a stone, he tells me that since I was able to walk into the office, I don't have a stone. If you had a kidney stone, you wouldn't be able to move past the stone 2 days later without medication. What in? Story 16, also not a doctor, but it happened to me. Went to the doctor because I found a little hard spot on my testicle. It felt like a little hard seed on the side of one testicle, definitely something new and weird, and it got me concerned. I go to the urologist and tell him I have something weird on the side of my testicle. He's confident I'm just feeling my epididymis, and I'm an idiot. He just keeps giving me biology lessons on what's inside a testicle. I tell him, no, I know what you're talking about. This is not it. It's hard to find it and feel it. And having a doctor twiddling my testicles between his finger and his thumb was not really getting anywhere. He suggests an ultrasound. I go get the ultrasound. The technician asks what I've been feeling. I explain. She's also convinced I'm just feeling my epididymis. Here we go again. I explain. She scans I go home. Doctor calls later that week. They found a calcification outside my testicle, and that's what I felt, but also it was no big deal and only to worry if it grew. Yeah, so it wasn't my epididymis. I was the patient. I was having difficulty swallowing water or food. I would swallow, and it would get stuck in my throat, and invariably I'd have to spit it back up and out. This went on for many months, not every time I ate or drank, but a lot of times. Finally went to see a GI specialist. They thought it was GERD or extreme acid reflux, which I knew I suffered from, but my condition was not just bad acid reflux. I was certain of it. I was told to go to a radiologist for a barium swallow test. While I'm swallowing the barium, I choke and spit it back up. The radiologist says, try again. I said, I just choked. Did you not see that? Nope. He hadn't. So I swallow again, and this time it goes down. He says he's got the film and to get dressed. He tells me that there's nothing wrong with my swallowing. I insist that can't be right. I know when I'm choking. He sends me home. A year goes by, during which time I'm progressively getting worse. Nearly every time I begin to eat or drink, I'm now throwing the food back up from the back of my throat. I've now seen several additional GI specialists who are concerned they may have misdiagnosed me. I'm sent back to the radiologist, the same radiologist. I tell him, Doc, I came here a year ago, and you said nothing was wrong. Well, I'm back. There's something wrong with my swallowing. He says, well, just swallow this barium. I choke on the spot. I see it. He says, you have an esophageal motility disorder. I say, this is the same thing I had when I came to you a year ago. He goes into his office and after 30 minutes returns and says to me, I just looked at your film from a year ago. It was there last year when we tested you. I missed it. Thanks for telling me what I knew over a year ago and for letting me choke for a year. His parting words, how have you managed to maintain your weight with your condition? I didn't give up trying to eat even when I felt I was going to choke to death. Edit, adding the following for others who may read this later. An esophageal specialist ultimately diagnosed me with heavy input and feedback from me, sharing every detail of when, how, what of the condition was critical in properly diagnosing my condition. I suffer from achalasia, a relatively rare motility disorder that mucks up peristalsis. It's idiopathic, in other words. They don't know what causes this condition. From Wikipedia, the most common form is primary achalasia, which has no known underlying cause. It is due to the failure of distal esophageal inhibitory neurons. However, a small proportion occurs secondary to other conditions. such as esophageal cancer, or Chagas disease, an infectious disease common in South America. 5. Achalasia affects about 1 person in 100,000 per year. 56. There is no gender predominance for the occurrence of disease. 7. There are several treatments for achalasia. A surgical procedure, called a myotomy, is known to alleviate symptoms. However, as far as I know, once you have achalasia, you suffer from achalasia, that is to say, you don't recover proper peristalsis, and instead, gravity has to do more of the work that peristalsis otherwise would. There are non-surgical options, such as drugs, Botox, and esophageal dilation. The wiki entry indicates that pneumatic dilation may be non-inferior to the laparoscopic myotomy I had. I had the procedure done over a decade ago, and this last bit about pneumatic dilation was not known to me or my surgeon at the time. And I had arguably the most well-known surgeon for achalasia in the country. Story 17, not a DR. Every time my wife had a little discomfort, her belly shed worry that it was ovarian cancer. She'd tell me that her worst nightmare was dying of ovarian cancer and leaving me with 2 young kids. And every time I'd tell her she was being silly and morbid, to try to comfort her so we could both go to sleep. Years go by, and she starts getting real pain. Turns out her gallbladder is swollen, and they remove it. So I tell her, see, it was your gallbladder all this time, but the pain doesn't go away. The doctors tell her it's from the surgery, but it gets worse. Eventually she gets an MRI, and it's ovarian cancer. 3.5 years of struggle later, and she dies at 50 of ovarian cancer. I kick myself for not taking her fear seriously and doing what could have found the cancer years sooner and possibly saved her life. She never worried about breast cancer or cervical cancer. It was always ovarian. I think that maybe your body tells you things and it shows up in fears and dreams and who knows how else. But maybe we should listen more carefully. Story 18, I'm no doctor, but this is something that happened to me. Earlier this year, I got sick, seemed like the flu, and felt absolutely horrible. Once I got healthy again, I started getting bruises for no reason and would get really easily winded just from brief exercise and pretty in shape. So this was odd to me and needless to say concerning. Of course, I Googled what I was feeling, and WebMD was telling me I have cancer or a blood problem, of course. I ended up seeing 4 different doctors who all told me that I'm paranoid and just need to relax, but I couldn't shake that I felt something was wrong. Finally, the 5th doctor I saw said she'd give me a blood test to calm my nerves, and the next morning I get a phone call in my dorm room saying that there's a bunch of things wrong and that I need to go to the hospital. When I asked what that could mean, they told me I could have leukemia. Needless to say, the scariest moment of my life, as I'm only 20. Long story short, months of doctor's visits and eventually a bone marrow biopsy revealed I don't have cancer, but a rare blood disorder called aplastic anemia, which causes your bone marrow to stop making cells. I'm happy to say after extensive treatment I'm doing well now. But it's very freaky to me that it took 5 different doctor's visits to finally hear me out when I said I felt something is wrong. Story 19, not a doctor, but had something similar happen to me. When I was younger, there was a stage where I was drinking loads of water and urinating a lot. My granddad kept telling my parents that I should be tested for diabetes, but my family would say he had no idea what he was talking about. Several weeks later, I'm at the doctor for my symptoms, and even the doctor said it probably wasn't diabetes, but reluctantly allowed me to have a blood test. Turns out I was type 1 diabetic, and after not receiving my blood test results back in time, I nearly died after eating a packet of lollies. Story 20, obligatory, not a doctor, but my sister was a 1st or 2nd year med student. My grandfather was having some sort of issue. She talked to him over the phone and suggested his doctor do such and such. Real doctor continued to do everything but that. And then after going to 3 different doctors, they finally landed on what my sister suggested in the first place. That's when we knew she was going to be a great doc. Story 21, picked up a long-term patient at County Hospital who was both epileptic and schizophrenic, and she told me her history with incredible insight and understanding. The reason she was there was because she was on Dilantin and meds for her schizophrenia. So she said, this is what happens. I'm taking all my meds, but I begin to cut back a bit on the stelazine for schizophrenia. Then I get a bit more paranoid and figure I'm being poisoned with the Dilantin. So I cut back on that and have a seizure. That cures my paranoia for a while and start taking my Dilantin and stelazine again. But then I get paranoid and stop taking as much of the one or the other, then get more paranoid, stop my Dilantin, get a seizure, and end up in here. She knew exactly what was going on. Incredible insight, and her record showed she was right. Incredible insight into what was happening, but completely powerless to stop it. Either the seizures made her sane a while, and things would balance out, and finally a few times a year she'd end up in hospital, because it would get out of control. Story 22, I was 9 when I fell off on my bike on a family bike ride. I was screaming like crazy, say my leg was broke, my parents thought I was crying wolf and told me to walk it off. When I wouldn't shut up, my dad carried me to the parking lot while my mom got the car. I remember my dad telling me to put my leg in a position if I truly thought it was broken, but he was still skeptical. Lo and behold, when we went to the ER to get an MRI, my leg had a spiral fracture. Story 23 had a patient who yelled code blue really loud from his room. As we all rushed into his room, his heart stopped. He didn't die that day, fortunately. Story 24, not the doctor, but the patient. Last year, I had 2 collapsed lungs in a 2-week time frame. After that, I had several occasions of thinking my lungs had popped again, but the doctors always said nothing was wrong. Cut to May, 2 weeks until summer break. I get the lung collapse feeling again, but due to the past, I wait over 12 hours. Eventually, I get an x-ray. It was a collapsed lung. Not only that, but the doctors realized that all those other instances actually were collapsed lungs, so the moral is that I should have trust in my own body, but wound up gaslighting myself because the ER couldn't find anything wrong with me. Story 25, I was in the 5th grade, complained to everyone including my school nurse and GP about a sore wrist after a bungee cord snapped on it. Flash forward 4 years, and I'm getting x-rays on them for carpal tunnel. They showed a fracture clear through the outside tip of my radius. Story 26, I picked the wrong thread to read as a hypochondriac. I was the self-diagnosee. I was 16, it was January of 2010, and I was in gym class one day. When my heart suddenly went crazy, it felt like it was about to beat out of my chest. I became dizzy, stopped moving, and a moment later my heart returned to its normal pace. The incident began to occur more frequently. I thought it was health-related, so I went on a diet. It didn't work. I tried the scientific approach and began to journal what I ate, did, etc. I found out that caffeine and chocolate tended to exacerbate my condition. I Googled my symptoms and causes and came up with the diagnosis of supraventricular tachycardia, aka SVT. I avoided anything that would bring on my symptoms and alerted my mom to the condition. She predictably said I was being melodramatic. Cut to August 24th. Mockingjay had come out and I was at home reading. I got up to get some water and there goes my heart, 200 BPM. I had learned by then that yawning or going into the fetal position and taking a deep breath would stop it. This time, nothing worked. An hour on, and my symptoms persisted. I called my mom and told her that I was going to the ER and to meet me there. The moment the front desk heard my heartbeat, I was pushed into a room and injected with about 4 different things. My mom was screaming. I told him calmly I have SVT. May I see a cardiologist? The doctor asked how I knew, and I told him the truth. I used Google and Mayo Clinic. He looked skeptical, but agreed that I needed to see a cardiologist. A week later, I'm in the cardiologist's office. I tell him my diagnosis, and he was surprisingly rather receptive. Meanwhile, my mother is still going on about me being over the top. The doc runs a few tests and confirms that I was right. I had SVT. The look on my mother's face is one I'll treasure forever. A few months later, I underwent a procedure and am now cured. Story 27, not the doctor, but the patient. I went to the ER with excruciating pain that I knew was kidney stones. I was vomiting and unable to move without help because it was so immobilizing. Doctor wouldn't listen and kept trying to insist that it was just a pulled muscle in my back. My mom, a nurse of 30 years, demanded an ultrasound as so far they had done no testing but palpating the area. He was stubborn and absolutely did not want to waste time. She threatened to report him for negligent patient care. I was literally puking into a basin as they stood on either side of my bed arguing. He finally caved and reluctantly sent me to get the ultrasound done. Wouldn't you know it, a stone was completely blocking my left ureter, causing a fluid buildup in my kidney, which in turn caused my kidney to swell up. They were able to get the stone out and get the swelling under control, but the ER doc refused to look my mother in the eye or acknowledge her after she proved him wrong. Story 28, not a doctor, but the patient who accurately self-diagnosed. I've been having really odd symptoms after a trip to the ER for a kidney infection. I had finished my prescription for the antibiotics they prescribed, but was waking up every morning bloated to the point I looked pregnant. I'd be rushing to the bathroom several times a day and would only pass mucus rather than stool. Gross, I know, and my stomach was cramping anytime I ate anything. I was extremely uncomfortable and miserable. Finally, it got to the point I was down to 99 pounds, and my fiancé, then boyfriend, said it's probably time to pop into the doctor's office, to which I agreed. I started researching my symptoms more and started to think I actually had a C. diff infection. I bring this up with my doctor in my appointment, and she says, no, that can't be. The antibiotics you were on aren't known to cause C. diff. It's probably stomach ulcers. I kept pushing and told her I at least wanted some way of testing for it, which was a stool sample. She reluctantly agreed, like I wanted to sift through my, come on, and I got it back to her same day. She kept saying she really doubts I have C. diff, and the results will most likely be negative. Okay, whatever amused me, I want to say the next day she calls and asks me to come in immediately. It tested positive. Part of me was actually extremely relieved because now we had an answer and I was overfeel like literally every day. 6 rounds of antibiotics later and a trip to the specialist more times than I could count. It finally went away. If the last round hadn't worked, the specialist wanted to discuss a fecal transplant, which I wasn't too pumped about. It took me a while to put weight back on, but I'm not sure how long it would have taken to catch if I hadn't kept insisting on at least doing a test for it. Listen to your gut. In my case, literally listening to my gut got me out of shitty situation, pun intended, sooner than later. Story 29 edit. I misread the prompt. The weirdest accurate self-diagnosis I saw was a woman whose body autonomously self-treated her medical condition. She came to the hospital with bad anemia, a hemoglobin of around 4, which is much lower than the general lower limit of 12, which have been slowly developing over the past few months. We asked her if she had any medical conditions, and she said she had previously been diagnosed with polycythemia vera, which is when you make too much hemoglobin. She told us that diagnosis was more than a decade ago, and she was never treated for it and didn't take anything for it. We found that surprising, as we would have expected problems to occur if that was the case. We thought maybe she was mistaken. Nope. Turns out she really did have polycythemia vera, and she also had a small periodic bleeding blood vessel in her small intestine. As a result, she had actually been treating her polycythemia vera by bleeding a little bit of the extra hemoglobin out periodically for the past several years. For a story of a self-misdiagnosis last year, a woman very wrongly told me she was in a wheelchair due to recent development of sciatica leg pain caused by irritation of the sciatic nerve. It wasn't the problem, she was in the hospital for trouble breathing, so we almost didn't pay enough attention to it. The tip-off was that she hadn't been to the doctor in about 20 years, so asked her who diagnosed the sciatica. She said she Googled it and figured out herself. It wasn't sciatica, it was lung cancer that had spread to her hip, causing what is known as a pathologic fracture. The cancer formed a weak spot in the bone and broke, crushing some of her nerves and causing intense pain. The cancer was so advanced that she didn't even make it home from the hospital. Don't put off seeing a doctor, folks. Her death could have been preventable if the cancer had been caught earlier, and she had symptoms for years. Story 30. I had a DAR, switch my blood pressure meds to lisinopril. Well, apparently a cough is a side effect, so I'm up coughing most of the night. So I tell my regular PCP, and he takes me off it immediately. The weird cough never went away. I returned to my PCP about a month later and told him the cough was still there, and it was a weird cough at that. Then I said both my parents died of lung cancer. He sent me FO and X-ray. Nothing. CT scan showed something. I have scarred lungs from histoplasmosis as a kid. Then the PET scan. It came up with the white light. Sure enough, I had lung cancer. It was in the very first stage. A lower lobectomy was performed, and I just don't think about it at all. My PCP just kept saying unbelievable. Good thing he wasn't in and actually listened and took action. So I had lung cancer for a total of about 3 weeks. Story 31, current resident. But this story comes from clinical rotations in medical school. The patient was being admitted with weight loss and painless jaundice. The patient and their family just got back from a trip to Hawaii, and they thought it was just like heaven on earth. They jokingly said they would do anything to go back soon. The punchline, the patient had advanced pancreatic cancer and died 10 days later. Edit only clarified the last sentence. Story 32, when I was pregnant with my second, they decided that my daughter must have some sort of dwarfism. Because I wasn't measuring properly. I was 511 and 155 pounds prior to pregnancy, and I just shrugged them off saying I was just a big girl with more room for a baby to grow. I wore my pre-pregnancy jeans to 7 months pregnant. I heard secondhand some friends had wondered if I had a miscarriage because of my lack of belly. I got it. I didn't appear to be expanding with a baby normally, but I was sure that soon-to-be baby was fine, and I just had extra room for her to hide in. They sent me for a couple of ultrasounds, all of which confirmed their diagnosis. I disagreed. Ultrasounds can be significantly off for measurements in particular, and the growth rate was always steady. A week prior to delivery, they predicted she would be 4 to 5 pounds tops, based on an ultrasound. They also attempted to prepare me for the complexities of having a little person. They honestly seemed frustrated by my denial stage. My daughter was born a healthy 8 pounds 7 ounces. She is now 6, already 45, and is definitely not a little person. TLDR doctor said I was pregnant with a little person. Turns out I just have a really roomy uterus. Story 33. I appreciate that the questions wasn't about DRS up, but I feel I need to defend my erstwhile profession. For all of those not a docs out there diagnosing themselves, I would like to say that being an ER doc is probably the hardest job. Not only do you need to know potentially hundreds of diseases and the thousands of tests and signs that may or may not point to them, But if you screw up, someone could die. Even if you don't screw up, and they could still die despite correct best efforts. That person dying may well haunt you for months with the what-ifs. This gig is really tough. How many stories do you think would be here if the question was, what stories do you have of going to the ER and the doctor tested for really rare diseases, only to find out it was something trivial and common for symptoms? For all those hundreds or thousands of patients with headaches who are convinced they have a brain tumor, maybe one will have a tumor, but you can't do an urgent CT or MRI on them all. I am not excusing poor practice, and there are some really bad docs out there like every job, but everyone makes mistakes. Everyone.